Hello, and welcome to this edition of Joint Action. This podcast is dedicated to all those out there who have osteoarthritis. On the show, we unpack the truth and demystify the myths about the disease and its management. If you have joint pain and want to know more about how to manage it from the world's best experts, you have come to the right place. Without further ado, it is time to welcome your host, David Hunter.
Hello and welcome to this edition of the Joint Action podcast. Today we have the privilege of chatting to someone with osteoarthritis. It's so important to hear from patients that are out there, people that have osteoarthritis, their experience, rather than necessarily just the ivory tower professor waffling on about the osteoarthritis experience. One really important and common misconception about osteoarthritis is that it's an old person's disease. However, we know that it can commonly affect younger people as well. And on this week's episode of Joint Action, we'll hear from Meaghan and her journey with osteoarthritis and in particular weight loss. Now, oftentimes osteoarthritis is described as old knees in a young person. And that's definitely, to some extent, what we're talking about here with Meaghan, who's someone who's experienced a joint injury playing sport, and a sport that she continues to love at a relatively young age, and the consequences of that injury later in life. But I think the more important message that we're going to get from Meaghan is that about the importance of continuing to pursue and be positive about the experience of osteoarthritis and what you can continue to do despite oftentimes a disheartening diagnosis. I guess firstly, by way of introduction, Meaghan Nixon is a martial artist, and she's practiced karate for over 20 years and has competed both nationally and internationally representing Australia. Her career highlights include a silver medal at the 2012 at the Shotokan Karate World Championships in Sydney, and also captaining the Australian team at 2 World Championships. Meaghan's played a variety of competitive sports that include soccer, baseball, and most recently, 3 seasons in the Sydney Women's Australian Football League competition. Throughout her career, Meaghan's experienced a range of injuries and musculoskeletal issues, including gluteal tendon problems, hip and ankle instability, misalignment of a knee, as well as having a reconstruction of her cruciate ligament, a shoulder reconstruction, and a knee arthroscopy. Hi, Meaghan, and welcome to the show.
Thanks for having me.
It's absolutely a pleasure, and it's so important, I think, for people who are out there who have osteoarthritis to actually hear from people who have the disease rather than these crusty, grey-haired old professors. Now, before we get into the main content of the show, in an effort for the listeners to get to know you a little bit better, can you just tell us a little bit about yourself?
No worries. So I'm 38 years old. I was born and raised in Sydney. Growing up, I played baseball from about age 5 until I was told girls don't play baseball anymore when I got to about 12. So I decided to take up karate. So I did that for a few years. And then I went back to that when I started uni. So about 20 years ago. I was also pretty keen on playing soccer and other sports sort of growing up. So yeah, I wasn't really into Barbie dolls and the like.
Fair enough. Do you still follow baseball?
I do, yeah. I'm a bit of a Dodgers fan, and I coached Little League baseball for the last 5 years, so that was pretty cool with some little champions over at Concord.
Oh, wonderful! Yeah, no, we got into baseball as a family when we lived in Boston for a number of years, and so still massive Red Sox fans, but don't get to play the Dodgers because they're in the opposite league so much. But for the karate, I think, as you know, our daughter does a lot of that. But what inspired you to get into karate in the first place?
Oh, my brother and I got into it probably, when I was a kid. My mum had done judo and jiu-jitsu when she was young. And then I think like every other kid growing up in the 80s, the Karate Kid was probably a big influence.
It sounds like you're getting back into whatever that remake is called. What did you call it?
Cobra Kai, yeah.
Yeah, and I have to get my daughter into that. But before I digress too much, can you tell us a little bit more about what you do professionally?
Yep. So I'm a national account manager for a large consumer healthcare company. So I work on a major supermarket account focusing on like oral care and vitamins category. So I essentially focus on managing the relationship between the two companies and ensuring that both businesses achieve mutual growth together. So it keeps me entertained.
Definitely. Sounds like a fascinating job. Now, when you're not doing your day job, what do you like to do?
All right. So I like to keep pretty busy. So I enjoy doing karate training. That's probably 3 to 4 times a week. And the social aspects that really go with that as well. So the post-training coffee and finding the best ramen in Sydney. I've also done a fair bit of traveling with those guys to train and compete around Australia and overseas. I've also recently started taking a bit of a boxing class with one of the karate instructors. So that's been really cool, having a bit of a hit out and being a total novice at something. Yeah, so that's been pretty good. And the other thing I sort of do to keep myself busy is taking up bike riding on your advice. So with some mates from karate, we're the Shotokan riders, and we've done the MS Sydney to the Gong Ride 3 times and have raised a bunch of cash. So sort of ride around Centennial Park, and it's also about the coffee as well, I think, more so than the bike riding.
So you're one of these people that we regularly see sitting in your lycra outside a cafe?
Yeah, well, just the Spruce Goose at Centennial Park seems to be the main hangout. So.
For the karate itself, you mentioned that you go overseas occasionally. What's your favorite destination?
That'd be Japan, hands down. So yeah, I first went there on a homestay when I was about 19 or so. I've been 8 times since. So been over there for karate competitions, training seminars, and a couple of years ago I went over to my host sister's wedding, which was pretty cool. So she was 14 when I met her. And she's now just had a baby and stuff. So yeah, to go to a Japanese wedding was pretty amazing too.
Oh, sounds superb. Yeah, I mean, it's a wonderful sport, and I think there's so much other activity that goes on around it, which sounds so inspiring. Now, obviously, the main content of the day is really to also get to know a little bit about your experience with this disease, osteoarthritis. How did you first come to develop osteoarthritis?
So growing up, I recall badly spraining one of my ankles when I was playing under 6 soccer. And then I remember that happened a couple more times. So it probably wasn't until, I think it was like my late 20s, early 30s, I'd been over to Montreal for a karate competition. And just all the walking around in New York, my ankle looked like it had a baseball in it. So probably wasn't eating the healthiest diet over there at the time either, fried chicken and waffles, whatever you can find. But yeah, it was sort of the time for me to actually then look into it and understand what was causing, such a crazy, inflammatory response. So I went to a knee surgeon I'd seen, who also looks after, like the Sydney Swans and arthroscopes for ankles and knees. And he just said, look, this doesn't look like an injury. And ordered some blood tests and gave me a referral to see you. And then it was all quite surprising. I didn't think, young people got osteoarthritis. So that was a bit of a disappointing conversation I remember having with you.
Yeah. So how long had you had symptoms before you were actually diagnosed?
Yeah, so it was probably about a year and a half. I'd had sort of 3 really bad attacks of inflammation. So just waking up in the morning and not really being able to walk and thinking, this is a bit weird, because there'd been no actual injury. Like, it's not like something had happened and then I'd had this inflammation. So there'd been a golf day I'd been to, and another time I was in Melbourne, we were doing this amazing race with work. So there'd probably just been more walking on it or something, but there was no actual trauma, and the inflammation was just kind of crazy. So growing up, I always had sort of that weak ankle and would sort of roll it every now and again. Even going on holidays, I generally will do some sort of little ankle roll. But it was mainly tracing it back. It's probably from that really early instances of spraining it badly.
Yeah, and so looking back, what age were you when you probably first started noticing symptoms that would be broadly consistent with the disease of osteoarthritis?
Yeah, I'd say it was about 28. Yeah, with that ankle one, and then the knee, that was only a couple of years ago. So sort of like late 2019.
Yeah, and whilst injury prevention in osteoarthritis is a relatively new concept, at any point in time while you were really active playing sport, whether it be karate, baseball, soccer, Australian football, did anybody ever talk to you about opportunities to prevent injury?
Not really. It was quite funny with my knee when I had my ACL done. I remember having a conversation with the surgeon, and the sort of discussion was like, well, if you don't get the ACL reconstruction done, you've got an increased risk of getting arthritis when you're older. Well, instead, it was the flip side. I ended up getting it when I was younger. So yeah, it was never really discussed at all. It was just, in my mind, something that old people get. So yeah, having listened to the podcast and hearing about injury prevention and you know, how surgery can also lead to an increased risk, kind of wish I had have known about some of those things at a younger age. Because it wasn't even something that was on my radar that I could have that, or that could be, you know, why I've even when I had it in my ankle, I was surprised to find out about the diagnosis in my knee when it had also had a big sort of attack of inflammation too.
Yeah, and I guess for the listeners out there, the ACL or the cruciate ligament, there's a wonderful episode that we did with Tim Hewitt last year where we talk about the impact of injury and the opportunities there for prevention. So for those of you that are interested, please go back and look at that. So now, Meaghan, you've had osteoarthritis and you've had symptoms now for a number of years. What have you found that works for you? And obviously you still remain an incredibly active person, and I guess I really want that message to come across. But what have you found that works for you?
So I started off there was this osteoarthritis joint health program I did twice a week at a private hospital in Sydney. So that was for 6 weeks. I did that twice a week, and it had a gym session supervised by a physio and a hydrotherapy session, which, look, I thought that was also going to be sort of just for old people, but they really ensured that was, you know, scaled up to my sort of activity level. And that was actually quite challenging. So I've continued to do that gym session once a week. And it's really sort of tailored to my needs, but ensuring, you know, firstly, that you actually do the exercises you need to do to really strengthen, you know, all the muscles and things around your knee, and also the knock-on effect, understanding that your whole body's connected. So yeah, working on your glutes. And for me, hip mobility has been something I've been sort of trying to focus on the last couple of months, because I think there's knock-on effects there. I also make sure I exercise regularly. So for me, I found where I have the most issues is where I'm inactive and then go to do a bunch of stuff. So when I worked out I had OA in my knee, it was after going from probably doing, you know, 3 hours of karate a week to 5 hours a day up in Rockhampton at a karate seminar. I'm pretty sure you told me I needed to use my brain next time I decided to do things like that, and
it would have been more subtle than that, wasn't it?
I think you were tapping your forehead, and I remember that. And then I was like, oh, what did he actually say? But just making sure that you don't do like go from zero to hero. And that's sometimes I'm a bull at a gate with certain things. So for me, I found doing more karate was actually beneficial. So I'm probably doing karate 3 to 4 times a week. I've got that boxing class. I do the physio class, and then I started walking as well. Probably 4 to 5 times a week for the last 8 months. So listening to the podcast, and I think you interviewed Steve Messier, and he was talking about the benefits of walking and aiming for 6,000 steps a day, not 10,000, and just sort of getting out and making sure that knee sort of keeps moving. Same with the ankle. They can just really stiffen up. Working from home during COVID, I think, you know, we weren't really getting out as much as we normally would be. So just keeping things moving. And then there were just the basic things. So, you know, making sure you've got good sport shoes. After seeing you weren't happy with the orthotics I had. So straight away I went and got some new orthotics. I got a knee brace, the unloaded knee brace. So I found that's been really good as well as other sorts of things, like making sure you've got a fairly healthy diet.
And I think just recounting that experience is so valuable, that there's not necessarily one trick that's going to fit all, and I think it needs to be definitely tailored to the individual. And a large proportion of this is also just learning what your knee can tolerate, and making sure that you understand that the knee oftentimes, as you've described, Meaghan, benefits from activity, and the longer you sit and the more sedentary you become, the stiffer and oftentimes more painful it can be. But by the same token, introducing activity that your knee is not necessarily accustomed to, it's just important you do that gradually over time. And as you, I guess, described it, not going from zero to hero, but understanding that the knee can tolerate still a reasonable amount of load. It just needs to learn to adjust for that and potentially accommodate for that. Now, one of the things you mentioned in there was getting some weight off. And you mentioned that you listened to the podcast with Steve Messier, and that may have stimulated that activity. So, one of the things you mentioned during that segment was that you lost weight. How did you go about doing that, and how long did it take?
It took me about 3 months to lose 11.5 kilos. So that was pretty positive. I sort of followed a low calorie diet. So I signed up for the Healthy Weight for Life program, which was really good. They provide you with some guidance and whatnot, and you sort of check in with them once a week as to how you're going. In terms of exercise, I just continued the current regime of what I was doing, however, implemented that daily walk. So I found that really made quite a difference. And just in terms of the diet, sort of the first 6 weeks was probably, sort of more strict. I sort of cut out the lattes, no ramen. I made sure I told my friends and family about it as well, so the temptation sort of wasn't there, or they understood why I didn't want to go out for ramen, and maybe a healthy Vietnamese salad might be a better idea. So basically, the morning and lunch, you'd have a shake and like berries or whatever for breakfast, a salad at lunch, and then just really maintaining just a healthy dinner. So you just sort of cut out the junk, and use the MyFitnessPal app a little bit as well, just to have a bit of an understanding of what you're actually doing. But it was, I didn't really find it too difficult. It was just about getting moving more and just that awareness of what you're doing. And I really see that there's quite a benefit in having that time frame and going, right, I'm going to do this, get it done with. And I think people get sick of diets and things, and it sort of sets them up for failure, I think, sometimes doing these unachievable things for a long period of time.
And obviously this is your personal experience and anecdotal, but what difference did that weight loss make to your symptoms?
Yeah, so for me, I found it's been a lot easier to move around at karate and things. So my legs are feeling a lot lighter. From the podcast, they talked about, 1 kilo of weight on the knee equating to 4 kilos of sort of extra pressure there. So every time I go for a walk, I'd be thinking, I've lost 3 kilos, I've lost 4 kilos. So to think that I've reduced the pressure on my knee by like 45 kilos is pretty awesome. So feel better and just I think I have a lot more energy as well. But it's also great to be able to fit back into your old jeans too. So
yeah, no, it's a great story to recount, and I think it's so important for people to understand that it does make a dramatic difference. And has it been something you've been able to maintain reasonably simply with regards to dietary change and integration into your life?
After completing the sort of first sort of two phases, the next phase was about maintenance. So that was then coming into Christmas. So things like ensuring that you're doing your meal planning for the week, I've sort of found that to be really beneficial and something that I've kept up. And if you're going out for dinner or whatever, don't go nuts on other things that day. I generally don't drink alcohol. I have a fairly low sugar diet, and if I am going to have some sort of treat, that better be awesome to be worth those calories. So I think it's just that mindfulness. And I think even some recipes and things that I like to cook, I've put them into MyFitnessPal, and just to have the awareness of, what's that cake worth in terms of calories and things like that is just sort of good to know. So I don't go around counting calories and things per se, but it's just that awareness of having that balanced plate, I guess. And I really love, eating veggies and things like that. So making sure you're loading your plate with those sorts of things I've found to be really, really sort of helpful things. So I definitely love food and consider myself a bit of a foodie. So it's just around, balance and making sure that it's the old, energy in, energy out.
It's really, really helpful. And I think your experience and success hopefully will be inspirational to others. And for those people out there who are looking for a little bit more information about diet and weight loss and the impact it can have on osteoarthritis, there's a couple of older episodes. Again, one that we did with Steve Messier, more looking at the evidence around diet and exercise and the importance of weight loss for symptom control and osteoarthritis. And another one that's a little bit more practical with Rosie Venman, a dietitian, about strategies that people can use to get that weight off. So I think your personal experience here, Meaghan, has been so helpful, I think, for a lot of people, hopefully, who are out there listening to this. But is there any one piece of advice that you'd like to give to people with osteoarthritis, particularly young people like yourself? What would you actually say to them?
So look, I think people need to have a can-do attitude. So focus on what you can control, not what you can't. So that's a big piece. Also, I think it's really important to keep active and follow your passion. So you might need to change some things, but don't quit what you love. And I know I sort of did that a little bit, taking a bit of a back step from karate, but actually I love it. And it's the social aspects that, sport can really provide you. So don't cut off those networks. The other thing I'd probably say is to make sure you find a good team of experts and people who you subscribe to their philosophy. So finding, the right, doctor, physio and whatnot, because you're going to see them. So you want to ensure that you're taking their advice and actually listening to them and making sure you've got a bunch of questions and things going in when you see those people to get the most out of that opportunity. And lastly, I would probably just say, look, reframe the diagnosis. It's not an old people's thing. You aren't falling apart. Your joints aren't crumbling. There's just this real negative perception about arthritis. Even, people think the pain and inflammation are making it worse. Like those, just myth bust those things and learn as much as you can about it. And I found listening to the podcast when I go out for a walk or whatnot, I've learned so much more about it. So sort of, lean into it rather than, be scared about it.
Yeah, such great wisdom from someone so young, Meaghan, and sagely advised, particularly the elements there about, leaning into it, being positive and making the most out of the fact that you can continue to do most of the things that you otherwise love and enjoy. It's such an important perspective. And I think for many people out there who are potentially getting disheartened, dispirited, isolated from this diagnosis, hopefully it gives them some solace and some words to act upon. Now, Meaghan, any final words that you'd like to pass on, or any little bits of tidbit that we didn't really cover that you'd like to convey?
Yeah, I just think people should really just get on board and take charge of their condition and just use the resources that are around. So this podcast I think has been fantastic. That the episode you mentioned about Rosie as well, that was fantastic. It all sort of aligns. I think you've really gotten a great group of people on there who subscribe to your sort of theories, and I think it's a fantastic opportunity to get so much more from a physician such as yourself. Normally you just go in and get your 15 minutes and then you're like, oh, I wish I should have asked this or that. But to continue that dialogue and for you to impact and affect other people around the world, I think it's fantastic. So you're doing a great job.
Meaghan, really appreciate the support, but particularly appreciate the opportunity to chat to you today. I think your perspective as someone who's young with this problem is so important, and I think heartening to people who are out there who are wanting to continue to pursue active, aggressive care and being integrated into their daily life. So thank you for your time, your insights, your thoughts. It's really, really valuable.
Fantastic. Thanks very much.
Been a great privilege to talk to someone who's so young, who's experiencing this disease, and the positive attitude that they're taking towards its ongoing management. I'm hoping that that's helpful for you, particularly as you balance the long-lasting interest that you might have, and oftentimes a challenging diagnosis that you take and get disheartened, dispirited, and isolated from. So hopefully take Meaghan's words as inspiration and an opportunity to rebalance and refocus on the things that you do enjoy, the things that you do love, and the fact that typically, if you give your joints an opportunity to do so, they can tolerate increased load. So stay positive, stay active, take that first step, and we look forward to speaking to you again soon.
Thanks for listening to Joint Action with David Hunter. If you like our show and want to know more, check out www.jointaction.info. If you have any questions, you can email us at hello@jointaction.info. And follow us on Twitter at jointactionorg. This podcast was hosted by David Hunter, edited by Vicky Duong, music produced by Jordan Hunter. The information posted on this podcast is not intended to diagnose, treat, cure, or prevent disease. Anyone seeking medical advice should consult a health professional.